But let's shift gears now and talk about naloxone accessibility. This is the overdose reversal drug. And given how deadly these overdoses can be, especially with fentanyl in the mix, having naloxone readily available seems like a no-brainer.
It's absolutely essential. And your sources, they really highlighted the push to make naloxone available over the counter, no prescription needed. The argument is that this could save so many lives. By making it easier to get, you're empowering not just medical professionals, but anyone, friends, family, people who use drugs themselves to reverse an overdose. And that quick action can make all the difference. The FDA recently approved over-the-counter naloxone, and that's a huge win for this movement.
Yeah, that feels like a massive step in the right direction. The sources even mentioned that some people believe this could save thousands of lives every year. That's incredible.
It is, but, and this is important, your sources also caution that over-the-counter availability isn't a magic bullet. It's a crucial piece of the puzzle, but it has to be part of a bigger strategy.
What do you mean?
Well, for one thing, affordability. Naloxone might be on the shelves, but if it's too expensive, the people who need it most might not be able to get it.
Right. Accessibility isn't just about whether you need a prescription. It's about whether you can actually afford it.
Exactly. And the sources also emphasize that even with over-the-counter availability, we can't abandon the existing ways of distributing naloxone.
Like through community organizations and healthcare providers.
Right. We need a multi-pronged approach. Community organizations, they often have these strong connections with people who might not be plugged into the healthcare system. And healthcare providers, they can still play a key role in educating people about naloxone and writing prescriptions when it's appropriate, even if it's also available without one.
It's kind of sobering to see that even with states passing laws to increase naloxone access, overdose deaths are still rising.
Yeah.
It really drives home the point that this crisis is incredibly complex and there's no single solution.
That's right. Wider access to naloxone is essential, but it needs to be part of a much broader strategy. We need strong prevention efforts, effective treatment options, and we need to address the social and economic factors that contribute to this whole problem in the first place. The shift to over-the-counter naloxone is a positive development, but it's not the end of the story. It needs to be done carefully, we need to ensure it's affordable, and we need healthcare professionals and community groups to stay involved in educating and distributing it. The fact that experts have been discussing and planning for over-the-counter naloxone for a long time, that really shows you how urgent and important this is.
It does. So making naloxone easier to get, including through over-the-counter sales, is a big step towards reducing overdose deaths, especially with fentanyl. But it needs to be affordable, and it can't be the only solution. Now let's talk about something that's really sensitive and really challenging, the stigma surrounding opioid addiction. Your sources were crystal clear. This is a major obstacle, and it often goes unaddressed.
Absolutely. The research you sent, it's powerful. It shows just how pervasive and damaging stigma is. It affects how the public sees people with opioid use disorder, how those individuals are treated by the healthcare system, by society. The language we use, it both reflects and reinforces this stigma.
The sources pointed out that certain groups face even higher levels of stigma. Men, people labeled as drug addicts, those who got opioids from friends. It's interesting. It shows that stigma isn't just this like blanket negativity.
Yeah.
It targets specific groups in different ways.
It does, and understanding those nuances is essential for tackling stigma effectively. Take the label drug addict. It's loaded with negative judgment. It reinforces the harmful idea that addiction is a moral failing, a choice, when in reality it's a complex health condition.
And what's really concerning is that the sources mentioned even healthcare professionals sometimes perpetuate stigma through their language. And that's really worrying because they're the ones who are supposed to be providing care and support.
It's a huge problem. When healthcare professionals use stigmatizing language, it creates this environment where people might not seek treatment at all. Or if they do, they might feel judged, misunderstood, and less likely to engage in their care. We need ongoing training, more awareness within the medical community so that we can use language that's compassionate, person-centered, and destigmatizing.
The sources really advocated for a fundamental shift in how we, as a society, view addiction, moving away from seeing it as a criminal issue and towards recognizing it as a chronic health condition. That seems like a big change.
It is, but it's so important. When we frame addiction as a chronic disease like diabetes or heart disease, we help destigmatize it. It encourages a more empathetic and supportive approach. It says, addiction is complex, it has biological, psychological, social roots, and people deserve access to treatment and care just like they would for any other chronic illness.
There was this great example in the sources about the difference between saying substance-exposed newborn versus addicted baby. It really highlights how the words we choose shape our attitudes, even towards infants.
It's subtle but powerful. The research acknowledged that the mother often faces blame and responsibility, perhaps unfairly in these situations. But the language we use can influence how we perceive them. Substance-exposed newborn is neutral. It focuses on the medical fact. Addicted baby that carries all this negative baggage, further stigmatizing both the child and the mother.
It seems like tackling stigma isn't just about being nice, it's about being effective.
Absolutely. Reducing stigma, it removes barriers that prevent people from getting help. It encourages them to reach out without fear of judgment. It saves lives. And it fosters a more supportive and understanding environment for people living with opioid use disorder.
So after this deep dive into everything you sent us, it's clear. The fentanyl crisis is multifaceted, and it's having devastating effects. It's not just about one drug. It's about all the factors that make it spread, the unique dangers compared to other opioids, the need for naloxone, and this huge hurdle of stigma.
And what's really fascinating is how these different aspects all connect. So fentanyl, it's incredibly potent, which means the risk of overdose is through the roof. That makes having naloxone accessible absolutely vital. But at the same time, the stigma around opioid use can prevent people from seeking out or even carrying naloxone. They're afraid of being judged. It's this tragic cycle.
So for those of you listening, what does this all mean? Hopefully this deep dive has given you a much clearer picture of what we're dealing with. We wanted to go beyond those sensational headlines and really get into the nitty-gritty.
So here's something to think about, and this builds on everything we've talked about today. Given the potency of fentanyl, the need for naloxone, and the powerful influence of stigma, what changes, real, tangible changes, can we make at the community level to effectively address this crisis? It's a question worth pondering.
It is. And on that note, we'll wrap things up for today. Thank you for listening.
Thanks, everyone.